How is the research, from your knowledge in this, in this field, how is the research into combating cancer as a whole and brain tumors, since it's your specific specialty? What is the research telling you about treatment over the next 5 to 10 years? Do you see an end, a light at the end of the tunnel?
I think so. Yes, I think this is a very exciting time for neuro-oncology. I think this is happening already, as I said to this earlier research that is published in this year's American Society of Clinical Oncology annual meeting. There are a lot of advances in last couple of years on research in brain tumor management, and the response rate were so much better compared to what we had for last 50 years for the brain tumors. So I think there's definite more targeted treatment that are coming in action along with conventional chemotherapy. Now people are using targeted treatment for particular part of the brain tumor. We are targeting with systemic chemo in addition to those targeted monoclonal or polyclonal antibodies against those tumors. We're now doing even brain tumor vaccine protocols and a lot of different immunotherapies that we're trying to.
So all of this, I presume, also sort of minimizes the damage to surrounding brain cells, the healthy cells.
Right.
Because normal conventional surgery would remove a lot of those cells.
Absolutely right.
I mean, there's the old joke about the surgeon at the operating table said, there go the piano lessons when they go into the brain.
Right.
But I presume today's patients have a better chance of surviving and retaining some of that memory power.
I think there is some newer advances in surgical techniques, and experienced surgeons definitely will make a significant impact on their quality of life. And I think with the people with the malignant brain tumor, our intention not only to improve their life but also to improve their quality, and I think quality of life is very, very important when you deal with some kind of progressive malignancy.
How's are you finding more people now learning about your brain tumor center at the Monmouth Medical Center?
Yes, I think this is I'm very excited about this, because this is the only comprehensive brain tumor center that now open in the state of New Jersey. We have a very excellent team of people there, including excellent neurosurgeons. We have a very, very good medical oncologist. We have excellent neuroradiologists. We have a pathologist, very well trained, and we have team of ancillary people, where social workers, we have
physical therapists,
physical therapy, rehab services affiliated with Monmouth Medical Center. We have neuropsychologists affiliated with our center. So we're having a package for person with the brain tumor. Once they have a brain tumor diagnosis, my intention is to have them call one number and tell us that I have a brain tumor, please help us. And
is there a number that you have that you could give us right now on the air, so anybody that may be interested, if you know the number, just say it to us.
Right. It is 1-877-577-9800.
Okay.
This is the number, toll-free number for Brain Tumor Center.
Okay.
Anybody who has a newly diagnosed or any questions about brain tumor, they can always call us.
Contact you all to find out what the next step should be.
Right, exactly. And I think that is also very important for patients and people to understand that we're here to provide them a guidance, to tell them what should they do next when they have diagnosis of brain tumor. We're not going to tell them to come to see us only. We're going to educate them that there is a help, what they need to know about their brain tumor care, and what are the best next steps that they should be taking in order to get them better faster.
Just so that viewers know, Dr. Raval, your background, you're originally from India, you've been educated in Gujarat, and then you came to the United States. Give us a little bit about your background so we familiarize people with who you are.
I was born in my hometown is Billimora, which is a small town in Gujarat, and I went to school there called M&R Tata High School. After finishing my high school, I went to MP Shah Medical College, which is in Jamnagar, and where I did my MBBS, and then I came here after finishing my MBBS, and then I did my postdoctoral fellowship at University of Medicine Dentistry of New Jersey with Dr. Peter Dowling and Dr. Stuart Cook in his lab, and we were able to publish lots of papers on multiple sclerosis at that time. Then I went on and did my neurology residency there at University of Medicine Dentistry of New Jersey, And after I finished my neurology residency, I started to look into the fellowship, and that's where I went into Sloan Kettering Neuro-Oncology Fellowship, where also at a fellowship offer at Massachusetts General Hospital in Boston. And I ended up going to Sloan Kettering for my Neuro-Oncology Fellowship. After I finished my fellowship there, I worked there as an attending neuro-oncologist before I came to New Jersey.
Okay, so you got this big, vast training, etc. So in a word, before we end this interview, you as a doctor, are you optimistic, really optimistic, that this whole thing can be beaten at some point in the near future or long-term future?
I am very optimistic. I think there is definite hope and there is definite chances here, and I think it is going to happen sometime in my career because there are lots of advances, and as I understand that my center is not a major academic center, but in collaboration with most major brain tumor centers throughout the country and world, we should be able to provide them most current and updated clinical trials and updated treatments as well. And I am very hopeful that next decade will have a definite more effective chemo regimen for most lethal brain tumors called glioblastoma multiforme.
Okay, I want to thank you. This has been a fascinating discussion. I must say I've learned a lot myself, and I'm sure my viewers share that feeling with me. I want to thank you, Dr. Sumul Raval, for joining us here. You are the medical director at the David S. Zocchi Brain Tumor Center at the Monmouth Medical Center here in New Jersey, the state of New Jersey. He's a board-certified neurologist, neuro-oncologist. Thank you so much for sharing your wisdom with us. Good luck with your project and the treatment that you have initiated, which is being emulated, as I said, around the country. And we hope to have you back here in the near future again on TV.
Thank you for having me.
All right. Thank you, viewers, for watching. This has been a special edition of Face to Face. I'm Rohit Vyas.